Your doctor prescribed you a pill for blood pressure, but what they didn't tell you might be just as important as a prescription itself. If you are taking Amlodipine, Losartan, or Lisinopril right now, or if someone you love is on one of these medications, please stop what you are doing and watch this entire video, because today I am going to share 5 critical things that most seniors on blood pressure medications are never told. Things that could make the difference between these drugs working beautifully for you or quietly causing problems you would never connect to your medication. I am talking about timing, food interactions, supplement combinations, side effects that get dismissed as just aging, and one shocking nutrient depletion that a 2019 study published in the Journal of the American College of Cardiology found affects up to 73% of seniors on long-term antihypertensive therapy. 73%. And most of them had no idea. Now here is what I want to tease right now before we even get into our list number 1 on today's countdown is something that genuinely surprised me when I first encountered it in the research. It involves a common fruit that half of you probably have sitting in your kitchen right now, and it could be silently undermining your medication at the cellular level. So stay with me all the way to the end, because number 1 is not something you want to miss. Before we dive in, I want to ask you something personal. Leave a comment below and tell me your age and which blood pressure medication you are currently taking. Are you on Amlodipine, Losartan, Lisinopril, or maybe a combination? I read every single comment on this channel, and your answer helps me create videos that are genuinely useful for where you are in your health journey right now. And if you find value in what we share here, consider hitting that like button before we get started. It truly helps us reach more seniors who need this information. Now let's count down from 5 to 1. Coming in at number 5, and this one catches almost everyone off guard, is the truth about taking your blood pressure medication at the wrong time of day. Most people wake up in the morning, take their pill with breakfast, and assume they have done everything right. Their doctor handed them a prescription, maybe said, take once daily, and that was that. But here is what the research tells us, and this is important. Blood pressure in the human body is not a flat, constant number throughout the day. It follows what scientists call a circadian rhythm. In healthy individuals, blood pressure dips naturally during sleep by about 10 to 20%, and then it surges in the early morning hours, right around the time most of us are waking up. This surge, which researchers at the University of Vigo in Spain studied in a landmark trial involving over 19,000 patients, is actually the window of highest cardiovascular risk. Heart attacks and strokes occur most frequently in the early morning hours for exactly this reason. Now here is where it gets critical for seniors specifically. After the age of 65, the body's internal clock, what scientists call the circadian mechanism, begins to weaken. Your body becomes less efficient at managing that morning blood pressure surge on its own. And if you are taking a once daily medication in the morning, it may peak in your system mid-morning when you actually need it less, and wear thin by 3 or 4 in the morning when your pressure is quietly climbing. The Hygia chronotherapy trial, one of the largest studies of its kind, found that patients who took their antihypertensive medication at bedtime rather than in the morning had a 45% lower risk of cardiovascular events, including heart attack, stroke, and heart failure death. 45% from simply changing when they swallowed the pill. Now, I want you to hear this clearly. Do not change when you take your medication without talking to your doctor first. Every individual is different, and your physician needs to guide that decision. But the conversation is worth having, especially if you are 70 or older. Ask your doctor about nighttime dosing. Bring this up at your next appointment. That one question could be one of the most valuable things you do for your heart. The practical tip here is simple. If your doctor does recommend bedtime dosing, take it 30 minutes before you lie down with a small glass of water, not food, and pair this timing shift with a consistent sleep routine because the medication works in harmony with your body's natural rhythms, and the more regular your sleep cycle, the more effectively it can do its job. Number 4 on our countdown is something I call the silent pressure on your kidneys, and it applies especially if you are on Lisinopril or Losartan. These two medications belong to different drug classes. Lisinopril is an ACE inhibitor, meaning it blocks an enzyme that causes blood vessels to constrict. Losartan is an ARB, an angiotensin receptor blocker, which essentially locks the door on the same chemical pathway. Both are remarkably effective, but both also change how your kidneys handle potassium, and after the age of 70, this becomes genuinely important. Let me introduce you to Gerald, a 74-year-old retired school teacher from Baton Rouge, Louisiana. Gerald had been on Lisinopril for 6 years without any issues, but over the course of about 8 months, he started experiencing muscle weakness, occasional heart palpitations, and a fatigue he described as bone deep. He mentioned these symptoms to 3 different doctors and was told each time that it was simply aging. It was not aging. When Gerald finally had comprehensive blood work done, his potassium levels were critically elevated, a condition called hyperkalemia. The Lisinopril, combined with his daily potassium supplement and a diet heavy in bananas and sweet potatoes, had pushed his potassium into a dangerous range, and nobody had connected the dots. Here is the science. ACE inhibitors and ARBs both reduce the amount of potassium excreted by the kidneys. In younger bodies, this self-corrects fairly efficiently, but a study from Johns Hopkins found that after age 65, kidney filtration rate declines by an average of 1% per year, meaning by the time you are 75, your kidneys may be functioning at 70 to 75% of their former capacity. This means excess potassium clears more slowly and it can accumulate quietly. The practical guidance here is this. If you are on Lisinopril or Losartan, ask your doctor how often you should be checking your kidney function and electrolytes. The general recommendation for stable patients is every 6 to 12 months, but many seniors go years without this check. You should also be aware that combining these medications with NSAIDs, common pain relievers like ibuprofen and naproxen, can significantly stress the kidneys and should be avoided unless your physician has specifically said otherwise. The synergy note here works in reverse. This is about what not to combine. Avoid potassium supplements unless your doctor has confirmed you need them. And be aware that salt substitutes, which seniors often reach for when trying to reduce sodium, are almost entirely made of potassium chloride. Read those labels. 1 teaspoon of a common salt substitute can contain as much potassium as 3 bananas. Number 3 on our countdown is one that affects the majority of people on amlodipine, and that is the truth about leg swelling, ankle edema, and what to actually do about it. Amlodipine is a calcium channel blocker, which means it works by relaxing the walls of your blood vessels, allowing blood to flow more freely and reducing the pressure against those walls. Think of it like loosening a kinked garden hose. The water flows through with less resistance. It is an excellent medication, widely prescribed, well tolerated in most people. But roughly 30% of patients on amlodipine develop peripheral edema, that's swelling in the feet, ankles, and lower legs. And the standard response from too many practitioners is a shrug and that's just a side effect you'll have to live with. But here is what those practitioners may not be telling you. First, this swelling is not dangerous fluid around your heart or lungs. It is a local effect of the blood vessels in your legs dilating and allowing fluid to shift into the surrounding tissue. It feels uncomfortable. It can affect your ability to walk and stay active. And it can actually worsen with age because the lymphatic system, your body's fluid drainage network, slows down significantly after age 70. Margaret, a 68-year-old retired nurse from Phoenix, Arizona, developed severe ankle swelling within 3 months of starting amlodipine. Her doctor told her to elevate her legs. That helped minimally. What actually helped Margaret was a 3-part approach her cardiologist eventually recommended, switching from once daily amlodipine to a twice daily smaller dose, adding a brief morning walking routine of just 20 minutes, and wearing graduated compression stockings of 15 to 20 millimeters of mercury during the day. Within 6 weeks, her swelling had reduced by what she described as 80%. The research backs this up. A study published in the Journal of Hypertension found that splitting the daily dose of amlodipine reduced peripheral edema incidence by up to 40% compared to single large doses. If you are experiencing swelling on amlodipine, this is a conversation worth having with your doctor. And never stop or reduce your medication on your own. That is a conversation, not a unilateral decision. The synergy tip for amlodipine users: magnesium glycinate, taken at a dose typically between 200 and 400 milligrams in the evening, has been shown in multiple studies to enhance the vascular relaxation effects of calcium channel blockers, while simultaneously supporting the lymphatic system's ability to manage fluid. Ask your doctor if this is appropriate for you. Scientific references, as always, are in the description below. Now, before we get to numbers 2 and 1, which I promise are the most important and the most surprising, if you are finding this information valuable and you are not yet subscribed to this channel, please take 2 seconds right now and hit that subscribe button. We publish research-backed health content every single week, specifically for adults over 60. And subscribing means you will never miss a video that could matter for your health or the health of someone you love. And if you found this helpful so far, a thumbs up takes 1 second and means the world to this channel. Number 2 in our countdown is about a drug interaction that affects your brain, not just your blood pressure. There is a growing body of research suggesting that long-term use of certain blood pressure medications has profound effects on cognitive function, some protective, some potentially problematic, and almost nobody is having this conversation with their patients. Let me explain. A landmark study from the National Institute on Aging, which followed over 9,000 seniors over a 12-year period, found that patients who maintained well-controlled blood pressure through medication had a 35% lower risk of developing dementia compared to those with uncontrolled hypertension. So blood pressure control is absolutely critical for brain health. Do not let anything you hear today make you afraid of your medication. But here is the nuance. The same study found that seniors whose blood pressure was controlled too aggressively, meaning it dropped below 110 systolic, had a 22% increased risk of cognitive events, likely because the aging brain depends on slightly higher perfusion pressure to deliver oxygen and nutrients effectively. After age 75, the brain's ability to auto-regulate blood flow decreases significantly, and blood pressure that dips too low during sleep or after standing up can cause what doctors call cerebral hypoperfusion, essentially brief periods where the brain is not getting quite enough blood. This matters enormously for seniors on Lisinopril or Losartan combined with diuretics, who may experience compounding blood pressure drops, particularly when standing up quickly, a phenomenon called orthostatic hypotension. If you have ever felt dizzy or lightheaded when rising from a chair or bed, you have experienced this. Research from Harvard Medical School estimates that up to 40% of adults over 70 on antihypertensive therapy experience clinically significant orthostatic hypotension, and it is a leading contributor to falls. Robert is a 79-year-old retired engineer from Cleveland, Ohio. He had been on a combination of Losartan and a diuretic for 4 years. His blood pressure readings were excellent. His doctor was pleased. But Robert had become increasingly fearful of getting up from his chair because 3 times in the past year he had gotten dizzy and nearly fallen. When his cardiologist reviewed his overnight blood pressure monitoring, she found that his pressure was dropping to 94/58 in the early morning hours, far too low for a man his age. Adjusting his medication timing and eliminating the diuretic on a trial basis resolved Robert's dizziness entirely within 2 weeks. The practical guidance. If you are on any combination of blood pressure medications, ask your doctor about a 24-hour ambulatory blood pressure monitor, a small device you wear for a full day and night that captures your blood pressure every 30 minutes. This gives your doctor a complete picture, not just the snapshot in the office. And when you wake up at night or in the morning, take 10 seconds before standing, sit at the edge of the bed first. Let your circulation adjust, then rise slowly. This simple habit prevents thousands of falls every year. And now, number 1, the thing I promised you at the very beginning, the fruit in your kitchen that could be undermining your blood pressure medication. That fruit is grapefruit. And if you are on amlodipine specifically, this is not just a minor concern. It is something your pharmacist may have mentioned briefly in passing, but the full picture is almost never explained. Here is the science, and I want to explain this in a way that really sticks with you. Your liver contains a family of enzymes called CYP3A4. Think of these like a processing plant that breaks down medications and prepares them to leave your body. These enzymes are responsible for metabolizing roughly 50% of all prescription drugs, including amlodipine. Now, grapefruit, and this includes grapefruit juice, pomelo, and certain varieties of Seville oranges, contains natural compounds called furanocoumarins. These compounds essentially shut down your CYP3A4 enzymes, not slow them down, shut them down. And here is the alarming part. This effect can last up to 72 hours from a single serving of grapefruit. What does that mean for you? It means if you eat half a grapefruit on Monday morning and take your amlodipine Monday night, the drug cannot be properly metabolized. Instead of absorbing a standard therapeutic dose, your body may absorb significantly more in some cases. Studies from the University of Toronto's Department of Clinical Pharmacology have documented blood concentration increases of 40 to 200% with grapefruit CYP3A4 interactions. That is 2 to 3 times your intended dose silently entering your bloodstream. This can cause dangerous drops in blood pressure, severe dizziness, heart palpitations, and in vulnerable individuals, it can trigger a cardiac event. After age 65, this interaction becomes more dangerous for a specific reason. The liver's enzyme production capacity declines naturally with age. A 2021 meta-analysis in clinical pharmacokinetics found that CYP3A4 activity decreases by approximately 30 to 40% in adults over 70 compared to young adults. This means your medication clearance is already slower, and grapefruit compounds that problem dramatically. Dorothy is a 72-year-old retired librarian from Savannah, Georgia. She had been doing everything right, taking her amlodipine faithfully every evening, walking 30 minutes a day, eating beautifully. But she had also started adding fresh squeezed grapefruit juice to her morning routine because she had read it was good for immune health. Over 6 weeks, Dorothy began experiencing episodes of extreme dizziness, flushing, and one terrifying morning where her blood pressure measured 82/51 at home. Her daughter brought her to urgent care. When her physician asked about her diet, the grapefruit came up. Dorothy eliminated it. Within a week, her blood pressure had stabilized beautifully. The practical guidance here is clear and immediate. If you are on amlodipine, avoid grapefruit and grapefruit juice entirely. Not occasionally, entirely. This is one of the most well-documented drug-food interactions in cardiovascular medicine. If you love grapefruit, speak to your doctor about whether an alternative calcium channel blocker without this interaction might be appropriate for you. The synergy tip to replace the antioxidant benefits of grapefruit. Reach for pomegranate juice instead, not grapefruit. Research from the Preventive Medicine Research Institute found that pomegranate juice actually has a mild antihypertensive effect of its own, reducing systolic blood pressure by an average of 5% with consistent daily consumption without any negative interaction with calcium channel blockers. 8 ounces in the morning is a beautiful complement to your blood pressure regimen. Now let us bring this home because I want you to leave today not just with information, but with something deeper. If you are in your 60s, 70s, or beyond, and you are managing your blood pressure with medication, please hear this. You are doing something incredibly right. You are engaging with your health. You are showing up. And the things we have covered today, dosing, timing, kidney protection, managing swelling, protecting your brain and your balance, and understanding that grapefruit interaction, these are not meant to frighten you. They are meant to empower you. Because the difference between a senior who thrives and one who simply survives is almost never the medication itself. It is the knowledge that surrounds it. Your independence, the ability to wake up and make your own breakfast, to walk to your mailbox, to play with your grandchildren on the floor. That is worth protecting with every tool available. And it is never too late to have a better conversation with your doctor, to ask one more question, to understand your body one layer deeper. I have seen patients in their 80s make changes that transformed the last decade of their lives. Age is not a ceiling. It is just a number on a chart. I want to thank you for spending this time with me today. If you learned something here, please share this video with someone you know who is on blood pressure medication. A spouse, a sibling, a neighbor. One share could genuinely protect someone's life. Subscribe to this channel so you never miss a video like this one. And leave me a comment right now. Which of these 5 things surprised you the most? And tell me what medications you are on. I read every comment, and your stories help shape what I create next. I will see you in the next video. Take good care of yourself. You deserve to feel well.